Hi, my name is JoAnne Donovan, and for the interview reflection video assignment, I interviewed Debbie Morrison. Debbie works for the state of Delaware diversion program as a diversion clinician. In this role, she's embedded within a local police department. She holds the credentials of a master's in psychology. She's a licensed master social worker and is a credentialed mental health screener and advanced alcohol and drug counselor in the state of Delaware. For her job duties, she is able to provide psychiatric and substance abuse support, education, and assessment of individuals and families in crisis or at risk. She responds with the police department to community visits, especially instances where crisis is anticipated, but is also part of proactive outreach, things like identifying individuals at risk for, say, domestic violence or homelessness or substance abuse. She also performs mobile crisis evaluations, using crisis evaluation instruments to conduct interviews and assessments while responding with police officers to certain calls for service. She works with clients and families to explore community support for mental health, substance abuse, and basic needs like housing, electricity, things like that. She also provides intervention services including crisis case management and short-term crisis counseling and follow-up to initial evaluations that she's completed. She also maintains linkages with specific community services by providing case documents and consultations to ensure problem resolution and appropriate referrals of services being made. Debbie describes the best part of her job duties is that she empowers clients to know, understand, and use available resources, providing resources such as phones, rides, or access to libraries, teaching them self-sufficiency, not just giving handouts. Another thing that has come out of her job is being an avenue for officer wellness. By developing a relationship with the police officers as they work together on a daily basis, they allow her to become a confidential ear to listen when they need to talk through something. This can help prevent the development of issues like post-traumatic stress disorder. As far as what Debbie finds fulfilling about her job, she likes knowing that every day she makes a difference. It might be small, but a difference nonetheless. She enjoys seeing someone struggling become empowered and understanding they have self-worth and are capable of overcoming their current battle. She said that the highest compliment that she ever received was from a client telling her how much she appreciated Debbie being there for her through her active addiction phase, during her recovery, and when she relapsed twice, and being non-judgmental the entire way. Debbie does find some parts of her job challenging, especially the days when she's not able to reach a client, which can cause her to doubt and ruminate about the situation, if she could have done something differently or said something differently or approached the situation differently, and sometimes that can cause guilt. She also finds it challenging being exposed to some victims witnessing violence and overdoses. She said that waiting for the Narcan to work is the most excruciating time frame, especially if she knows the person who overdosed, if they were one of her clients. She also finds it very difficult to learn of a client's death and feeling a sense of guilt from failing them in some way, potentially. For continuing her professional growth, Debbie maintains a joy of learning. She says she's lucky to have a supervisor who encourages ongoing education. She personally attends conferences whenever possible and attends at least 3 virtual training sessions a week. She likes to research new information that becomes available about drugs, gangs, and community resources. She's currently working on her autism certification, which will allow her to educate police departments and police officers on how to best interact with those of the autistic population. Debbie had some recommendations for students who are pursuing a career in the psychology field. First and foremost, she thinks they need to understand that not all days will be a good day. Changing the world single-handedly is impossible, but each positive encounter reverberates throughout the community. Understanding that there will be some failures, but there will be successes, and holding on to the successes rather than the failures will help you to remain positive and be less likely to become burnt out or develop compassion fatigue. She also recommends that any student pursuing a career in the psychology field, such as hers, should discover and implement self-care. Self-care is important to fill your cup as it gets emptied by the things that you experience in your field, especially a challenging field like this where there might be more failures than successes over a period of time. She recommends that you make personal wellness a priority. If your wellness falls below par, it limits your ability to help others and can lead to burnout and compassion fatigue. She wants you to know that developing things like post-traumatic stress or even post-traumatic stress disorder is possible. She stresses the importance of having someone to confide in, like the officers end up doing with her throughout their shift, or having an established relationship with a counselor to help communicate any issues that might be developing due to the exposure to some of the more difficult aspects of the job. In summary, Debbie is very happy to be working in her current role as a diversion clinician in the diversion program. She enjoys the relationship that she's established with the police officers that she works with, but also with the clients that she serves. Yes, it can be a heavy job at times, but it's also very rewarding. She would recommend this job to anyone who wants to help others on a daily basis, but also be able to be out in the field and meet clients in their most natural environments.